I am Haley Kenslia. I'm helping David Sencer to collect oral histories of workers who helped to eradicate smallpox. This is Craig Leutzinger. He's going to be talking to us today, and we have a couple questions for you, Craig. Craig, will you tell us a little bit about yourself, about your background?
I joined CDC in 1970, and...
Go back before that, Craig.
Oh, even before that. Well, I was raised in Southern California, went to the University of California, Riverside, anticipated going to Air Force pilot training, but I failed the physical. So I was looking for work and eventually saw an ad for the U.S. Public Health Service Syphilis Eradication Program, and I answered that ad, and after several months they offered me a job in Baltimore. So I went to Baltimore and started my career with CDC there doing syphilis contact tracing. 5 years later, I was with the STD program in Washington, D.C., and they were asking for people who might be interested in participating in the Smallpox Eradication Program. At that particular time, they were looking for people interested in going to India or Bangladesh. And I asked to be considered, and was picked to join a team that went to Bangladesh in May of 1975, as I recall.
And was it your first time out of the country?
Other than Mexico, yes.
And what kind of training did they offer you? Did the CDC give you any advice or training program or anything?
It was pretty fast. I think there was about a dozen of us, and we came from all over the country, and we were in Atlanta for, I think, no more than a day. We got some minimal briefings, and then flew to Delhi via London. Spent one day in Delhi, mostly acclimatizing ourselves. We didn't get any training that I recall. Then we thought we were, when we arrived the day after that in Dhaka, we thought we were going to get some training before going to the field. But the leaders there had decided that we would be better getting on-the-job training in the field. So the very next day, we split up and went to various districts in Bangladesh. I went with one other person to Camilla district, and we were met there by a CDC public health advisor named Gary Conrad. The first night he took us out to dinner at one of the finer restaurants in Camilla, which at that point in time didn't have silverware, so this was our first introduction to the local eating customs. And so then Gary and the area leader, Anders Bjorkman, began giving us more information about what we were expected to do. How long that lasted, I don't remember. Within a couple of days, I was sent north to the subdivision of Brahmanbaria, where I worked the remainder of my time.
And so this is where you, just to clarify, your background was working in Baltimore. You worked kind of combating syphilis. So were the backgrounds of the other 12 people you were with, were they similar to yours? Do you think the people that you were with were working more closely with smallpox before you left? Or?
No, their backgrounds were all similar. They were all public health advisors who started working with CDC in what was called VD control at the time, primarily syphilis, but some gonorrhea. There was one EIS officer who I think was in his first year. I believe he was from Rhode Island, so his background was a little bit different. And there may have been one or two of the public health advisors who had shifted from VD control to immunizations. But otherwise, we had no prior experience really in immunization work, let alone anything like smallpox eradication.
What did you think when they put you out in the field on the first day?
I was fairly numb, combination of jet lag, culture shock, the unknown, and being extremely conspicuous. Bangladesh, of course, was a new country. While there had been British in that area in the past, the area I got into really hadn't seen any non-Bengalis. Most of the kids thought I was pretty unusual, and wherever I was, there were dozens of people peering in the windows. So I did feel isolated and anxious to sink my teeth into something, so I'd begin to feel more comfortable.
Well, it definitely sounds like an interesting start to your work. So why don't you tell us a little bit about what exactly you did on a day-to-day basis, your time there?
In Bangladesh, they really had refined the eradication program and the techniques that were used, and they were really utilizing all of them. Of course, earlier in Africa, they had developed the strategies, and by 1975 in Bangladesh, they had pulled them all together in a pretty comprehensive program. Really, the primary strategy was containment of identified cases, and the containment involved keeping people with smallpox in their home, with people watching to be sure they didn't leave, and monitoring everybody that came and went. And to go into the house, you had to demonstrate that you had smallpox vaccination. And then in a ring around that household, they did a census to identify everybody who was living there, made sure they were all vaccinated, and monitored everybody coming and going, and made sure anybody arriving was vaccinated. Then in areas beyond the containment area, they did intensive surveillance or case finding. The time I got there, in my area, there were a couple of individuals who were recovering from smallpox. So there was containment taking place in those couple of villages. And my job was to visit those containment settings, observe what was going on, determine whether there was any potential gaps in how the containment was being carried out, and ultimately to pay the workers when they completed their work, which was an interesting experience in itself, because the denominations of the currency, I think, were all in one, I think was the taka denomination, or maybe it was a 10. But if you were paying somebody their living allowance for working in this village for a month, it was could be a couple hundred. And if you were paying 10 or 15 workers, you had to carry a lot of currency with you. So at times you felt like you were possibly a target carrying a backpack full of this currency. But no threatening circumstances ever came up.
Just for perspective, do you know, like when you said one taka, do you know about how much that would be in American dollars at the time, how much it was?
Wow. Of course, even the American dollar isn't worth what it was then. Yeah, my guess is something like 20 to 1, but I really don't remember.
And during this containment, how would people prove their vaccination?
By showing a scar on their arm.
And when you were paying the workers, were these workers Bengalis? They're people living in the village, or?
Yes, they were Bengalis. There was somebody, the existing health system had a worker assigned for every village, an FWW, family welfare worker. When a case was identified in a village, that FWW was to go to that village and take charge of the containment. They then hired people in the village to do the other tasks.
How did you find cases?
That was really what I did the majority of the time there, was case hunting, because those couple of villages were the last active cases in my time there. So very shortly after I got there, the work focused on case finding. There was a reward in place at the time that I arrived, 50 taka, and we had a picture of a person with smallpox that we would carry door to door, go into markets and show these pictures. Of course, I didn't speak the language, so there were surveillance teams that I accompanied that would fan out in villages or markets, trying to get information about people who had a fever rash illness that might be smallpox. Also, in the town that I was living in Brahmanbaria, we worked out an arrangement with the what amounted to the union of rickshaw drivers. That was the primary form of transportation for the locals. They had bicycle rickshaws. And the arrangement worked out was we were able to put a poster about the reward on the back of every one of the rickshaws. So for an entire day, we had sort of a checkpoint in every rickshaw that went by, would stop. We would put paste on the back of a poster and put it on the back of their rickshaw. Mostly they cooperated. Some were concerned that the glue was pretty permanent. And they took pride in their rickshaws, and they were afraid that they'd never get that poster off.
It's good advertising, definitely. So how long altogether was your stay in Bangladesh?
The total trip was about 3 months. And I was, with the exception of 4 or 5 days coming and 4 or 5 days leaving, the entire time was in Bangladesh.
When you were in the field, how did you communicate?
There was a telephone in the town, and there was, I'm pretty sure they called it telex. And as I recall, the Camilla district leader, Anders Bjorkman, was based in the town of Camilla. I think that was a 3 or 4 hour drive from where I was. And as I recall, communication was via telex between us. And on occasion, it was possible to talk by telephone.
When you traveled, would you travel by rickshaw, or did you travel over longer distances? Did you use a car?
We were each assigned a Jeep and a motorcycle, depending on the destination. And we did go very long distances. In one of the more fortunate developments after I arrived was my finding a translator who actually spoke English in a way that I could understand. It was more of an American English than an English. Very nice young man, probably about 20 years old, a student. His father owned a printing business in town. And he would always accompany me, and he was invaluable. I couldn't have really done anything without him. So the two of us would go via Jeep to some destinations, via motorcycle, which I hadn't really ridden a motorcycle before, so going via motorcycle with him on the back was sometimes scary. Sometimes we would take either the Jeep or the motorcycle part of the way, and then we would get in a boat. They had a lot of canals there, a fairly extensive canal system. And we would get in a boat, and they would push this boat with poles, and sometimes somebody would get out on the side and pull it with a rope. And we went quite long distances on that. Sometimes the ferry or the motorcycle was put on a ferry that crossed larger bodies of water. And then there was foot. Some destinations you could only reach by foot. Either we started out on foot or we went as far as we could by vehicle, and then we would walk 2 or 3 hours till we got to the village. And that was all surveillance. We were checking rumors of a fever rash illness going out to villages. And it was past the peak in Bangladesh, so I actually never did find a case.
When you were traveling, did your Jeep ever break down, or did you ever have any vehicle difficulty?
Not my Jeep. As I mentioned, I didn't know a whole lot about motorcycles, and I did have a motorcycle breakdown. It turned out I just wasn't educated on how to use the choke, and it had fouled the spark plug, and couldn't get all the way back to Brahmanbaria that night on the motorcycle. It just quit running. So ended up.
How did you find out what had been wrong with it? Did you bring it to a
We had to leave the
garage?
motorcycle, and we found somebody with a vehicle who took us the remaining 5 or 10 miles back to Brahmanbaria. We retrieved the motorcycle the next day, and then Jim Mize, who I had gone out to Camilla District, though he was in Shanpur to the south. At a later time, he came to Brahmanbaria, and he was a motorcycle hobbyist, and he knew what I had done wrong and cleaned the spark plug and taught me how to use the choke, and I was fine from that point on.
He's a good friend to have, it sounds
yes.
like.
My little experience in Bangladesh, it's not a funny country at all, but did anything funny ever happen to you?
Boy, I guess one thing that I had to view it with humor. I mentioned before the number of people who just stare at you, and the number of times I looked out a tea house window, and there were kids looking in the window, and some of them hanging upside down from the roof. And I can remember, turning my head towards the window and seeing heads coming from every direction. And I'm sure I chuckled at that. The only other thing I can recall is I had some beer at the government lodging where I was staying. But when I arrived there was not a working refrigerator. And there was a Baptist mission just a short distance at this government lodging that I was staying at. And I visited the mission and just asked, could I leave a couple of beers in their refrigerator until the weekend? And they sort of silently agreed. I must have been pretty clueless. So that weekend I went down and got the cold beers and enjoyed them. And then a week or so later I went back and asked to do the same thing, and they kind of frowned and said something like, well, this is a Baptist mission. And we really would prefer not to store your beer. And I guess there were some language oddities from time to time. I can remember laughing when they would say a word in a way that I didn't expect. Like one time my translator said he had a headache, and I didn't really understand what he meant. And no, head-osh is what he called it, head-osh. And finally, after a little back and forth, figured out he was meaning a headache. So every once in a while, there was some sort of twist in the language that made you laugh.
And you said you were there from about May through somewhere in August. What was the weather like?
Hot all the time.
Did your health change at all in the time you were there because of the change in diet or the climate?
I did lose a lot of weight. Well, not a lot. Probably lost about 20 pounds. Had a fair amount to eat, but you really, when you went out during the day, there wasn't much opportunity to eat something you knew was safe. So I always had a dute dim omelet, which was 2-egg omelet. Dute dim was 2 egg, and they kind of ran it all together to say dute dim omelet. So I had this 2-egg omelet every morning for breakfast, and then I'd get home at night and have a meal, but nothing in between. Dr. Sencer commented earlier, we saw a picture in the museum of somebody getting a drink from a coconut. That was something that was really wonderful. You could get fresh coconuts, and it was the most refreshing beverage you can imagine. But at night I would usually have chicken and rice. And so just, not that I didn't have a lot of food or that food wasn't available each day, it just wasn't available 3 meals a day. And of course it was lean food, much leaner than we eat in the United States. So I did lose weight. There were a couple of times when I was somewhat under the weather. I remember one trip with some others in a Jeep over a terribly bumpy road where I had probably a fever and headache and muscle aches, and every time we hit a bump I felt like I was going to explode. But that just lasted a couple of days. Otherwise my health was fine.
Will you tell us about the books that you brought?
Well, one is just some prints of Bangladesh that I have. I do have more pictures that are being digitized at the moment that I'm going to provide for the reunion later. Don't imagine the camera can see these very well. This is a picture of a market typical of where we would go to ask about fever rash illness, and here is a fairly typical picture of a village. The book is a WHO publication that was published, I believe, in 1980, that recounts the eradication of smallpox in Bangladesh very, very thoroughly. And of course, the last case of variola major occurred in Bangladesh with onset in October of 1975. It was 2 years later that the last case of smallpox of any kind, variola minor, occurred in Sudan. But that last case did occur that year in Bangladesh in 1975. Also have one of the certificates that the participants in the program were given as being inducted into the Order of the Bifurcated Needle, which is something I prize a great deal. What it says is the triumph belongs to an exceptional group of national workers and to a dedicated international staff from countries around the world who have shared privations and problems in pursuit of the common goal, smallpox target zero. This is presented to Craig Leutzinger, one of the international staff who assisted the World Health Organization in this historic venture. The Order of the Bifurcated Needle is given as recognition of participation in this great achievement, Geneva, 1976. And this on my lapel is a bifurcated needle that has been bent into a circle as a lapel pin, which was accompanied the certificate.
And when did you receive the certificate?
It would have been sometime in 1976. At the time, I had come back to the United States and taken a new assignment in Anchorage, Alaska, and it was mailed to me there.
Do you keep in touch? You mentioned a reunion. Do you keep in touch with any of the workers that were there at the same time as you?
Well, not in any continual way. There have been a couple of people that were with me in that group who worked on the same campus that I did. In the last 5 years that I was with CDC, I worked in the Chambly campus. And there were 2 people from the group that I worked in Bangladesh with that had jobs at the same campus, so I saw them regularly. But since I retired, I have not been in touch with them. And Jim Mize, who I was actually in Camilla District with, moved to North Carolina, and I haven't seen him since or had any contact with him. I did have contact with a non-CDCer who had been in the Peace Corps and came to work in Camilla District with our group. Quite a few years later, I was working for the Behavioral Risk Factor Surveillance System, and Harry McGee was in charge of that system in the state of Michigan. And we had an annual meeting, and he walked up to me, and he remembered me, but the idea of meeting somebody at this meeting from smallpox days didn't occur to me. So when he introduced himself, I remembered him from Camilla District. So I have crossed paths with some. I remember another, Dr. Larry Brilliant, who did not work with in Bangladesh, but he was in the Delhi office. I was actually on a work trip from Anchorage to Barrow, Alaska, visiting the STD workers there, and walked in, and there was Larry Brilliant meeting with one of the staff. So I met him in Delhi and Barrow, Alaska.
He's been all over the world. So you mentioned meeting a Peace Corps worker when you were during your time in Bangladesh. Was there kind of a social scene of Americans that you?
No, he was actually hired by WHO to be part of the smallpox team. There was no Peace Corps presence there at all.
So what was your housing situation? Like you mentioned government housing. Did you have a small apartment or?
I was fairly fortunate. Some of the others in my team had less desirable lodging. The government did maintain a system of very small hotels, usually 2, maybe 3 rooms, so that when government workers were traveling around the country, they would have a place to stay. There was one of these in Brahmanbaria. It was in quite good condition. It had 3 rooms. Each of the rooms had a private combination shower and toilet, and a dining room that these bedrooms opened up on, and there was a cook available that was assigned to be there for anybody that was staying there. So I had quite nice quarters. There was a bed with a bed net, and I was able to, as I left each morning, ask the cook to prepare the meal that night, and he always had a good meal ready for me. So I had pretty good quarters. Others were staying in semi-abandoned buildings, not as comfortable as what I had.
Well, looking back, if you could cite maybe an event in your life or something from before you left, is there any reason, any particular event or moment in your life that might have driven you to choose to kind of go to Bangladesh and be part of this program?
Oh, I wouldn't say that it was so much focused on Bangladesh. I had been working in syphilis control for 5 years when the opportunity came up. That's a pretty narrow part of public health. As I said earlier, I took the job because my expected career path didn't work out. So I knew nothing about public health. I didn't have any education on public health like the general public at large. If you ask them what public health is, they don't have any idea. So I didn't know either. I've been working in syphilis control, but that is a very narrow part of public health. I had the opportunity to hear from somebody else who had been to India working on smallpox, and clearly it was a much broader application of public health. It sounded very interesting and quite an adventure. So when they were asking for people who were interested to go, I really jumped at the opportunity. Didn't know whether I'd go to India or Bangladesh. It turned out to be Bangladesh. And that certainly exposed me to a much broader strategy of public health. Syphilis control is very focused on people exposed to the disease. The smallpox strategy includes mass immunization as well as contact tracing. But the entire system, too, of passing along information to trace people in other jurisdictions, it really opened my eyes to the many other things that go on in public health that I really hadn't been involved in yet. And when I came back, I hadn't probably thought about it at the time, but I think I would not have been interested in doing VD control for the rest of my career. But having that experience made me feel like public health was a good career and a good fit for me, and so I did stay in public health and had the opportunity to do a lot of different things in my career.
And you're kind of on this role already, but do you think that your time in Bangladesh affected your worldview? And you mentioned it affected kind of your career path.
Absolutely. One of the first things you realize when you come back, well, let me first say that Bangladesh, of course, was part of Pakistan. It was a new country at the time we went. As part of Pakistan, it was impoverished. As a new country, it was even further impoverished. It, at the time, had the highest population density of any country in the world, and I believe still does, other than such city-states as Monaco. They had, in 1975, 85 million people in an area the size of the state of Wisconsin. So in their infrastructure there, they essentially got that part of the world because nobody else wanted it. There was very little infrastructure. Telephones, transportation, and so forth were pretty non-existent. So when I came back, the first thing that hits you is the United States is the best place in the world to live. Nevertheless, you feel very strange when you get back. But from that, I felt very strongly that our culture put far too much priority on material things, and that the wealth we have in the United States, we really have a responsibility to share it. Using that wealth for lifestyle when so many other parts of the world have so little is something that since that time I've felt strongly about. Also, it certainly showed me that people of totally different countries, different cultures, different ethnicity can work very closely together, achieve incredible goals successfully, even though our governments can't. So, I just feel like, and it's certainly happening as time has gone on. There is so much more interaction between the people of the world that I think makes much more difference in a future peaceful world than what comes out of our government interactions.
Thank you.
Yes, thank you so much.